Is chiropractic care in the U.S.
Chiropractic medicine.
really as controversial as Joe Rogan claims?
Now I'm angry.
Let's dive into the debate. Join me as we explore Rogan's personal experiences and the historical context of chiropractic, while uncovering the stark differences between practices in the U.S. and Canada, Quebec.
I had a podcast that I did with my friend Steve Ranella a few weeks back.
Okay.
And he has a brother that has a herniated disc real bad. And he's got atrophy in one of his arms because he's got a pushed nerve and, the whole thing, bulging disc. It's a pretty common injury with martial artists.
Yeah. That's something, get yourself to a physical therapist.
Yeah, right away. And get an MRI and then spinal decompression, the whole deal.
Do
and just see
everything
whatever.
you can, science-based, absolutely.
Many things need clarification. Loss of strength and the onset of muscle atrophy associated with regional pain are clear signs of an invasive spinal lesion, and, in this case, a symptomatic herniated disc. As for whom to consult for a herniated disc, it depends on the patient's level of functioning and their goals. If the condition is deteriorating rapidly, a surgical option may be considered. Otherwise, conservative treatments focusing on strengthening muscle groups and decompression therapy can be pursued. However, it is important to note that there is currently no solid evidence to confirm the effectiveness of decompression therapies in treating this condition.
So he goes, what do you think about chiropractors? And I go, so I say, I think chiropractors are bullshit.
To provide proper context, it is important to note that in the United States, chiropractors do not have a professional order to regulate their practice with standards of practice, ethical behavior, and especially to ensure public safety by following an evidence-based approach.
And then he goes, really? I go, yeah. I go, I've just had bad experiences with it, and then I've read some things about it being bullshit.
If you want to better understand the situation of chiropractic in the United States, influenced by an extremely divided climate, particularly on religious grounds, the link to the video should appear in the top right corner of your screen. Otherwise, write Chiro USA in the comments to be notified.
So anyway, I smoked the pot, and then I go, God, maybe I'm a dick. Maybe I was rude saying, because I know people that are chiropractors, and I know they're nice people, and I know they mean well. And I'm like, maybe I'm a dick.
I think that's accurate. I think they mean well.
Some of them, sure.
I think they're wrong, but they mean well.
This is the whole power and the risk of chiropractic in the United States. One phrase to never forget, especially in this context: never attribute to malice what stupidity can more easily explain, or in this case, therapeutic naivete.
I go, maybe I was being a dick. So then I Google chiropractic, and then I start reading. And I spend hours and hours reading about the history of I'm going to say this in big air quotes, chiropractic medicine. And I go,
the history of chiropractic is marked by questionable religious beliefs about the influence of subluxation on health, as well as by practices with charlatan undertones, such as magnetic healing. Unfortunately, the early days of this profession continue to influence chiropractic in the United States, where there is strong resistance to the evolution toward evidence-based practice, EBP, like that adopted in Canada.
Holy fucking shit. Not only do I not feel bad now I'm angry.
Don't feel bad at all.
Is this due to the American geopolitical climate that fosters such extremism, or to the lack of legislation governing the profession? Regardless, it is the sad reality in the United States.
I'm sure a lot of you mean well. I'm sure a lot of you do well. I'm sure a lot of you try really hard to help your patients, and I'm sure a lot of you incorporate a lot of other stuff, like massage and cold laser and real science into your therapies.
It's important to understand that cold laser massage, interferential therapy, ultrasound, decompression techniques, manual therapy, whether through mobilizations, soft tissue work, adjustments, etc., they're all essentially the same thing. Right now, it's a melting pot where we don't really know what actually works. This also applies to acupuncture and anything that touches on musculoskeletal pain. The evidence is currently extremely murky, and we have no clear idea of what truly works in most cases. We have anecdotes and scientific evidence pointing in certain directions for specific conditions, but nothing general. The way we should approach musculoskeletal pain and conservative treatments now is not so much about the specific technique or tools we use, but rather about referring to Canadian agencies to guide our practices. This includes the Canadian Chiropractic Guideline Initiative, CCGI, which suggests best practices emphasizing a multimodal approach. This means not just performing manipulations, but also combining them with mobilizations, exercises, and passive modalities. In short, it's about having an approach that includes many modalities and techniques together, but most importantly, ensuring that what we offer to patients aligns with their therapeutic values. Because the therapeutic values of patients are key to alleviating this kind of pain. After that, we provide exercises, whether done in the clinic or given to the patient to do at home, empowering them to regain their autonomy. But above all, and I keep repeating this, which may be tiring for long-time followers of my channel, we need to stop thinking that the therapy itself is what's most important. It's more about the patient feeling autonomous with their pain and feeling in control. This requires explanations about the diagnosis and clinical prognosis. Patients need to understand their limitations and how long recovery might take. We need to remove unnecessary barriers that prevent patients from incorporating physical exercise and training without negative thoughts about movement, pain, or catastrophic thinking. That's what's most important. So, Rogan often expresses a biased view in his discussions, and we see this currently because it's not his area of expertise. The key is to respect what I've just outlined, and from there, we will not only have an evidence-based practice, but also one that maximizes patient outcomes.
But the original guy who created chiropractic medicine was a complete, total bullshit artist.
Fucking whack job.
This guy right here.
Yes, he was indeed special with very religious pretensions.
This character.
Daniel David Palmer. So he started out...
He's a magnetic healer in Davenport, Iowa. I mean, the whole thing is 100% horseshit.
And I mean, this article that we wrote, we sent this through, I mean, normally my articles, I go through at least, 2 editors, give or take. This one we put through, I believe, 3 editors, a fact checker, and our lawyer to make sure that we were bulletproof on it, because we wanted to make sure that we, that we didn't say anything that could get us sued, basically. And a lot of the information from this came directly from his book.
Yes, his books are still frequently used by purists in chiropractic who blindly believe in the power of subluxation to restore nerve flow, which they claim facilitates the return to homeostasis and the healing of all pathologies affecting humans. There are still a lot of topics to cover. If you want the continuation, the link should be available now. In the meantime, write me your comments, your questions, your suggestions, or simply if you have any more questions.